The temperature is dropping and cases of the common cold, they're rising. But be warned, there's a new study. It finds that forcing all that mucus out may not be that great for you. Here for more on this and other health headlines is physician and CETA Med founder, Dr. Lipi Roy. Doc, welcome back. Always great to have you.
Good to see you, Hena.
So let's start with the story surprising a lot of people that you could be blowing your nose the wrong way. Talk to me about that.
So there's a right and a wrong way to blow your nose, and I didn't know. Did you know that?
No idea.
I didn't know that either. But specifically, forcefully blowing your nose can actually lead to other health problems, such as ear pain, nosebleeds, headaches, and even orbital fractures, which can lead to eye swelling and vision loss. And the reason for this is because when you blow your nose too forcefully, instead of going out to the tissue, it can actually go back, and that can make the infection worse. So how does that happen? That contaminated mucus, when it goes back into your sterile eustachian tubes, which connects back to your throat and sinuses, which are all sterile areas, and that's how it can worsen an infection.
So what's the right way to blow your nose?
So, first of all, there's actually a really good brief video, a YouTube video by the Rush University Medical Center on how to properly blow your nose. But really briefly, key points. Just first of all, just gently blowing your nose can help control the mucus. Blowing one nostril at a time can help. And then just using topics such as, oh, yes, and also just squeezing the mucus out can help. But also better than just not blowing at all is using nasal saline through a neti pot to drain out the sinuses.
I'm glad you mentioned the saline. Any other home remedies, of course, besides cold medicine, but what else can we do at home?
To address the common cold? Yeah, absolutely. Good old-fashioned, plenty of fluids, plenty of rest, as well as over-the-counter medications for headaches, body aches, and just washing your hands constantly. And if you have to be out in public, then making sure, or around other people, make sure you wear a mask.
Yeah, I think that's always good advice. I do want to turn some news regarding milk, the safety of milk. We know it's a hot topic. The FDA now mandating federal bird flu testing in milk in many states. They include California, Oregon, Pennsylvania. I have to ask your thoughts on this.
Yeah, so the USDA, Department of Agriculture, released a report or launched the National Milk Testing Strategy in response to the outbreak of the highly pathogenic avian influenza H5N1, which they found in cattle. So, and there's this new federal order along with guidance to really address the rise in H5N1 that's been detected in poultry and in dairy cattle and in humans in multiple outbreaks in multiple states. So the reason for this is that there's concern that when you don't pasteurize milk, so raw milk is unpasteurized, the process of pasteurization basically treats milk with mild heat, which kills off or at least eliminates harmful bacteria, and it increases the shelf life. The CDC has said that pasteurized milk is actually much, much safer than raw milk. So the process of pasteurization actually reduces the risk of milk-borne illnesses.
So how concerned should the average consumer be? Is this simply just avoiding raw milk for a while?
Yeah, so the guidance by the CDC, and by the way, the California Department of Agriculture, Food and Agriculture has also recommended people avoid raw milk because of the concern for these diseases. And again, the CDC recommends drinking pasteurized milk. So for people out in the public, when you're going grocery shopping, make sure you look carefully at the labels, nutrition labels, and purchase products, especially milk products that are pasteurized.
Thank you so much for that. I have over a minute, but I want to talk to you about this discovery where humans, we've gained a few years when it comes to life expectancy, but not as many years as many doctors and scientists were expecting. Why is that?
Yeah, so the life expectancy in 2022 was about 78.3, and it's projected in 2050 to be about 80.4. So that slight increase is because of a decrease in mortality from our big killers, stroke, heart disease, and diabetes. But it's not predicted to increase as much as we would like to, and that's because these researchers found that we need to do a better job controlling the health risks, and specifically with obesity, smoking, and substance use or drug overdose. As you know, I'm an addiction medicine doctor, so this is something I've been talking about for many, many years. And the researchers are predicting that drug overdoses and overdose-related deaths will actually increase significantly over the next several years, if not several decades. So we need a lot more better prevention and treatment options and interventions for substance use, but as well smoking and addressing obesity as well, Hena.
That is fascinating. There is one. Thanks for watching. Go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.